So hello, thank you very much Peter for inviting me here today to talk to you a little bit about some market research that we've done. But before I get on to that, my name is Tiberio Catania. I work for the EPG Communication Group, made up of various different organisations, EPG Health, EPG Online, which is a platform and a website for healthcare professionals that gives them access to medical and scientific content and educational content, and DMC, a digital medical communications company. So the discussion I'm going to go through in the next sort of 10 to 12 minutes is around scientific meetings in the digital age. And it's really born from a market research report that we've recently carried out, conducted in May 2017. The findings came out in around September. We asked over 100 questions, and lots of those questions had questions within questions, so got a huge amount of data that we collected. Over 457 respondents. I think the interesting thing is that we looked at it not just from the point of view of the healthcare professional, of course very important, but also we asked questions, some the same, some slightly different, to the pharmaceutical industry themselves, and also service providers, medical communications companies, advertising agencies, those types of partners in the industry as well. So a huge amount of information. The report looks something like this. It's quite weighty, around 80 pages, with a huge amount of content in there. But really for today, what I'm going to try and do over the next 10 or 12 minutes is focus in on just some of the key highlights and really look at what is the demand for scientific meetings, is there a gap in the supply, and what does that gap look like, and what are the challenges faced by both the healthcare professionals and also the industry as well. So I'll focus in on the healthcare professional insights really to start with. I think that's probably the most interesting part of it. And I think what we wanted to do was sort of ask them, as you saw at the beginning, the what, where, when and how. So we started off with the what, and really the what is you know, what sort of do scientific meetings still play an important role in their education and in terms of gaining new skills and information. So overwhelmingly, 2/3 of them said that it was still the most important way for them to get the new information and skills. So still very, very important in terms of a channel for them to be able to go and get this sort of information. So that was good, and we sort of thought that that was going to be the answer. But I think we then wanted to ask a little bit more around the where. So where are they going for this information, or where would they like to go for this information? So we started to look a little bit more and ask them around the online channels, and certainly 89% we can see they want access to meetings online. So we can see that there is certainly this demand has been there for a few years, but it's a growing demand. What was interesting as well is that when we asked them about whether they always or whether they usually investigate some of this virtual or online access, over half said that they do look for that sort of online access. So they are searching for this type of information, which again, really, really important. And then when we asked them about what we felt in terms of the future, in terms of online attendance, again, over half said that they expect that their online attendance would increase over the next 12 months. So clearly, really, I mean, there's clear an increase in demand for online event access and content. So again, probably something we probably already knew, but it's really nice to see the extent to which that demand is really there. So then we wanted to ask them a little bit around the when. So when do they want access to this content? And I think what was interesting here is really that they're saying that they want access to this conference material throughout the year, rather than really limited to the duration of the event. We see a huge amount of, we see spikes obviously in people searching for things around particular events, big congresses, the ASCOs or the ESMOs of this world. But what was interesting actually, what they're saying is that they really want the access throughout the year. So again, really in terms of the considerations for us as an industry, and the challenge I suppose is, you know, are we able to, and do we make that content available on demand and online? And do we really consider how that content really needs to be, or how that content is going to be consumed online and on demand? So again, something we'll probably touch on a little bit later in terms of the formats. And I think interestingly, I use this slide because I think this shows us really as general consumers where we're going. We want everything on demand now, whether it be music, whether we're streaming the music, whether it be Netflix or Sky Anytime, all of those sort of media channels that are out there now. We don't wait for the end of the week or once a week to get our fix of whatever it might be, Game of Thrones or EastEnders. We want to go in there and consume it when we want to, at the time that suits us, not at a time that suits necessarily the publisher of this content. And I think we're seeing that even now with things like Prime Now, where they're actually starting to deliver goods within an hour of you ordering them. So it's a really a very, very fast-moving area, and I think healthcare professionals are no different. They want this content on demand when they want to see it. So then we wanted to ask them a little bit more around the why. So what does that mean? Okay, yes, you want it online, you want it on demand, but what really, what are the reasons behind that? And again, I think, you know, what was interesting here is we saw a lot of the things that we expected to see. Of course, it's more convenient to get this content online and on demand. It saves them time, and they're increasingly becoming busier and busier people, healthcare professionals. They save money, and I know we talk a little bit about the regulations and how it's becoming increasingly difficult for pharmaceutical companies to actually subsidise the cost of getting doctors to these types of events. So it's really important in terms of saving money. And I think importantly as well, it allows them to look at a wider range and a frequency of meetings, so they can go in and see more at a time that suits them. I think what was really interesting, which was this sort of finding, which was one that was probably slightly unexpected, but 90%, so a huge number, said that actually that the information and the discussion beyond that scientific meeting really helps them apply new medical approaches more quickly. So I think I think this is the real key for me is that the enduring content is really essential. And again, when you think about some of these medical congresses, they might last 3 or 4 days. The programs are intense, they're packed. And there's so many things, not only so many things going on, but there are so many things going on at the same time. 10 or 12 symposia running all at the same time. It seems crazy. There's no way that anyone can possibly engage with that. So it's really essential. But I think the real key is it makes a difference to the way that they approach new medical approaches, I should say. So I think that was a really interesting point that came out of it. And then we wanted to ask them a little bit around the formats as well, so the how. And we asked them about what they saw as high value content. And again, probably no great surprises, but what was interesting really is that there are a lot of different types of content that they really value as high. So videos of opinion leaders and presentations, case studies, discussions, e-learning modules, conference highlights, useful links, again, really important to provide them with links to other places where maybe you as an organisation or it might not be your thing, but certainly provide them with information to that, patient information, for example, and expert opinions. So I think really when we're thinking around scientific meetings and we're thinking about putting some of that content online, I think really the message there is look at how you repurpose that content, but also think about how you can wrap in other high value content to increase that engagement. Of course, medical congresses happen, once or twice a year in terms of certain areas, the big congresses anyway. And it's about making sure that you have a dialogue with them throughout the year and adding in other types of high value content. So to keep them engaged, to keep them coming back in again. So then we wanted to ask them a little bit about who from. So really, where did they feel that they could get this content from? Now, you'll see in the report that we also asked them about the pharmaceutical industry and asked them about their portals, and they do value them. I think what was interesting though is they do still tend to value the independent portals higher. So 88% agreed that independent meeting portals were of higher value. I think part of the reason for that is obviously there's the credibility and the trust issue, but I think the other reason is really the independent platforms can look at lots of different types of content from lots of different congresses and lots of different pharmaceutical companies, so they can come and engage in a wider range of content. So I think that's really important. When we then asked a little bit more into the pharma industry really about their investments and what they're doing to support this, again, what was interesting was that 71% said that they invest more in their own portals than the independent portals. So I think there is still a little bit of this fixation of we want to own it and we want to own the space, even though perhaps maybe the healthcare professional seems to think otherwise. But I think partly, this high level of investment is because it does take a huge amount of investment to build your own portal. So you are going to get a disproportionate amount of spend if you're going to build your own, rather than going on somebody else's. So I think, but there's always that issue between sort of control, if you like. Obviously, if you build your own, you can control the content much more, but does that matter if ultimately the users aren't coming into that platform? I think the other thing that was interesting was when we asked the doctors about what the greatest obstacle was, it was actually in accessing online materials. So they're looking for it, but they're probably struggling to find it because it's either not there or it's certainly, they're not able to find it. So again, really, I think that was a really important point. There still seems to be a lack of good quality content out there that they can easily access. So I think the considerations there is do we have the right balance between pharma run and third-party portals? And I think importantly as well is how can we use, or how can generally the pharmaceutical industry use third-party portals effectively to help build their own audience. There is a place for the pharmaceutical industry's own portals for them to talk about their products and their brands and their services. It's absolutely essential, but it's about how do you get maybe the healthcare professionals there, and perhaps working in collaboration with independent portals. That could be a way of getting them there, so when they're right and they're ready to go and learn more about the actual brand or the product, that there are the links, the routes into there. So that was really 7 or 8 minutes probably around the healthcare professionals. One of the things I wanted to do as well was look at a little bit around the pharma insights, so look at some of the findings we got from the guys in the industry. And I think again what was really interesting was that you see on the left hand side that 88% want to support more online access for meetings. So there's a real desire from the industry generally to support this type of access. So that's really great. However, when we asked them about their high focus areas, less than a third said that actually that was one of their high focus areas. So of course what we wanted to understand is you seem to have this desire, you want to do it, but you're not really focusing on it. What's the problem? What's stopping you from doing that? What's stopping you from taking that next step? And I think there are genuine barriers. Some of them might be more perceived than others, but certainly when we asked them around some of the barriers, over half reported the lack of confidence in the benefits of these types of delivering content in this way. The lack of budget, which I think is always probably one of those that I'm not too sure whether I believe it. I think the budget is there. It's about how you spend it and where you spend it. I've been to some of the medical congresses. You can clearly see there's a lot of money being spent within some of these areas. So I think I'm not too sure whether that's a real obstacle or just a perceived one. And I think, of course, the change management, the internal reluctance to change. So I think really in terms of the obstacles, in terms of the considerations or to think about is really how and who can help overcome these obstacles. Of course, medical communications organisations are really good at helping them, guiding them and getting them through some of these barriers. Most pharmaceutical companies now are employing people from even outside the industry, digital experts, multi-channel or omni-channel experts, and I think it's about using them and using them to make sure that they can be confident that there are benefits in providing this type of content and looking at what value that provides. So when we went on to ask those that do it, and that are doing it at the moment, the pharmaceutical companies, was really to ask them what they were getting from it. So what benefits could they see that they were deriving from it? And as you can see there on the left, they can reach a larger, a more broader audience. Very important when we think of in terms of geographies, so being able to get to markets or areas where maybe it's traditionally difficult for those healthcare professionals to come to some of these congresses. I think the interesting one for me was around the multidisciplinary as well. When we're seeing this, treating patients is becoming much more complex. The number of different types of healthcare professionals and different specialists treating patients is increasing, and actually so whilst some of these scientific events are great, very often they attract an audience that is quite niche, if you like, certainly around particular specialisms. So it's how do we get that content, repurpose it for a different type of healthcare professional. So that was really interesting, and certainly something that we've seen from some of the stuff that we do. And of course you can increase the total volume. So you go to a scientific event, you might be lucky and get 1,000 people in a room, and there you have to be, that's not easy to do. But of course, if you can make that content available online on demand, you can increase by 5-10 times. Saving cost and resource, so that was an interesting one when some said that one of the challenges was the lack of budget. I think some see it as and they've been able to actually save some cost and resource. Increasing the lifespan of the conference content, and again this was really interesting because it's clear that the industry is saying that actually there is a benefit in increasing the lifespan. The healthcare professionals are telling us that they want it throughout the whole year because they just can't consume all of that information all in one go. And not only that, but the healthcare professionals are telling us that it actually makes a difference to their clinical practice. So that was a really interesting one, and one that I think is great. And the last one really is an effective alternative to on-site meetings. So, you know, potentially you can run more events, you can do some virtual events, live events, and actually get some of that content out there without actually having to attend an on-site meeting or actually invest in an on-site meeting. So that really is pretty much some of the insights that I wanted to go through today. So I suppose really to finish off in terms of conclusions, I think what was interesting is certainly we can see that there is compelling evidence to support change. We suspected it, we could see it from the data that we're collecting that doctors are engaging with this, but it's always nice to have some evidence from some market research. We're all sort of pretty much evidence-based. I think what was interesting is that, you know, it isn't about one channel, it isn't about doing one thing rather than the other, it's about doing lots of different things, and this multi or omni-channel approach is really required. So, you know, thinking about it, you know, having the live symposia, perhaps looking at live streaming as well. And live streaming in and of itself doesn't necessarily bring in huge numbers, but that content then can be repurposed and can be left on site in terms of enduring materials. Congress exhibitions, print materials. So I think, you know, that's really the answer is look at all those channels and look at how that content is disseminated throughout those channels. So the parting points really from me we shouldn't really be sitting here discussing whether we should be doing it, but how we should be doing it. I mean, it's very, very clear the demand is there. And I think the last point, and certainly from some of the projects that we run and some of the projects that I've been involved with over the years, is have a vision and make sure that that vision is something that you want to aim towards, but really make getting started simple. Too often I see sitting down at a table and having this massive master plan and trying to achieve too much too early, and actually it's really about getting started, looking at that content, thinking about that content before you're creating it, on which channels you're going to put it on, how then you need to create it, and getting that on there and seeing if it works, seeing if it resonates, and then adapting that. So that's it really for me. The whole presentation, research is available to download free. So you can have a look at it there. There's some case studies as well. So that's it from me today. So thank you very much for your time.